Influenza Competency Number 2 Patient Care Questions 13. Question number 1. Which of the following recommendations would you make to your patients during influenza season? I. Wash hands often or use hand sanitizer. 2. Cough or sneeze into sleeve if tissues not available. 3. Stay home from work or school if symptoms are present. IV. Get the influenza vaccine early in the season. A. I and IV. B. 2 and 3. C. I. 2 and 3. D. All of the above. Answer. D. All of the above are recommended. See Therapeutic Choices 6th ed. Question number 2. You are the visiting pharmacist at a long-term care facility. You are making a presentation to the nurses and support staff on how to control influenza spread during a possible outbreak. Which of the following recommendations should you make? I. Encourage hand washing of all staff, residents and visitors. 2. Confine ill residents to their rooms until their illness has resolved. 3. Administer antiviral agent to all residents during influenza outbreak. IV. Administer influenza vaccine to all residents and staff. A. I and IV. B. 2 and 3. C. I. 2 and IVD. All of the above. The correct answer is D. All of the above. See Therapeutic Choices 6th ed. pp. 1380–81. Question number 3. Which of the following are considered antiviral agents used to treat and prevent influenza? I. Oseltamivir. 2. Zanamivir. 3. Agriflu IV. Amantadine. A. I and 3. B. I and 2. C. I only. D. 3 and IV. The correct answer is B. Chemoprophylaxis with antiviral agents have their greatest utility in the long-term care environment, nursing and retirement homes. Amantadine has exhibited high levels of resistance and is therefore no longer recommended for prophylaxis. Oseltamivir is the first-line agent during outbreaks of influenza A or B. Be aware of the potential difficulty of using zanamivir in the frail elderly. See reference CTC 7. pp. 1406. Question number 4. A doctor visiting a nursing home for the first time calls you and asks what dosage he should prescribe for oseltamivir to treat a 77-year-old patient with influenza. The patient has normal kidney function and is otherwise healthy. You respond. A. 150 mg daily for 5 days. B. 300 mg bid for 7 days. C. 75 mg bid for 5 days. D. 30 mg bid for 5 days. The correct answer is C. See Therapeutic Choices 6th ed. pp. 1388. Question number 5. Which of the following are not recommended analgesics or antipyretic agents for anyone below the age of 18 years? A. ASA. B. Ibuprofen. C. Acetaminophen. D. Naproxen. The correct answer is A. ASA is not recommended because of the associated risk with Ray's syndrome. Ibuprofen and acetaminophen are the preferred antipyretic analgesics. See Therapeutic Choices 6th ed. Question number 6. A physician asks for your advice regarding the use of oseltamivir to treat influenza in an 80-year-old that has impaired kidney function. The patient's creatinine clearance is less than 10 milliliters per minute. What is the recommended dose of oseltamivir? A. 75 milligrams BID for 5 days. B. 75 milligrams is a single dose. C. 150 milligrams BID for 5 days. D. Use zanamivir instead. The correct answer is B. See Therapeutic Choices 6th ed. pp. 1388. Question number 7. What are the most common side effects of oseltamivir? A. Fatigue. B. Influenza-like symptoms. C. Nausea and vomiting. D. Cough. The correct answer is C. CECPS 2012 under Tamiflu. Question number 8. A physician asks for your advice for using zanamivir as a treatment for influenza. Which of the following recommendations would you make? I. Do not use for influenza since there is increased resistance to. Treatment should be started within 48 hours of symptoms. 3. Do not use in patients with asthma or COPD because of the risk of bronchospasm. IV. The dose is 1 inhalation through the nose once daily. A. I only. B. 2 and 3. C. IV. D. 2, 3 and IV. The correct answer is B. Zanamivir is effective for influenza A and B. The dosage is 2 inhalations 10 mg BID for 5 days. Do not use in patients with asthma or COPD due to risk of bronchospasm. See Therapeutic Choices 6th ed. pp. 1389 Table 2. Question number 9. There is a large outbreak of influenza in your province. The commercially available oseltamivir powder for oral suspension is unavailable from the manufacturer due to increased demand. You receive a prescription for oseltamivir suspension for a 15 kg, 13-month-old child. What dose would you give to treat a 15 kg child to treat influenza? A. 7.5 mg BID. B. 15 mg BID. C. 30 mg BID. D. 45 mg BID. The correct answer is C. See Therapeutic Choices 6th ed. pp. 1388 and ECPS 2012, Tamiflu monograph. Question number 10. There is a large outbreak of influenza in your province. The commercially available oseltamivir powder for oral suspension is unavailable from the manufacturer due to increased demand. You receive a prescription for oseltamivir suspension for a 15 kg, 13-month-old child. What is the final concentration of oseltamivir in the manufacturer-recommended compounded formulation of the drug for this child? A. 6 mg dose. B. 10 mg dose. C. 15 mg dose. D. 30 mg dose. The correct answer is D. Reference: Tamiflu product monograph URL forms products consumer information monographs and public advisories Tamiflu Tamiflu_PM_E PDF. Question number 11. What is the usual recovery time for patients who have contracted influenza? A. Between 2 and 5 days. B. Between 7 and 10 days. C. Between 5 and 11 days. D. Between 8 and 20 days. Answer: B. Reference: URL. Question number 12. Which of the following are considered high-risk patients in terms of complications or hospitalizations from the flu?
For upcoming videos.
A.
Feel free to share
Children 6
videos
to
and channel
59
link.
months of age. B. Person older than 65 years of age. C. Adults with chronic conditions like COPD or diabetes. D. All of the above. Answer: D. The following categories of people are most at risk of flu-related complications such as pneumonia, adults with chronic health conditions, diabetes, cancer, renal disease, anemia, people older than 65 years of age, healthy pregnant women, Aboriginal people, children 6 to 59 months of age. Reference: URL. Question number 13. In the past, patients with an allergy to which item were not considered safe candidates for the influenza vaccination? A. Nuts. B. Milk. C. Eggs. D. Gluten. Answer: C. The National Advisory Committee on Immunization (NACI) has stated that individuals with egg allergies may be vaccinated against influenza using a full dose of trivalent or quadrivalent inactivated influenza vaccine. Reference: URL.